It is important to remember that lifestyle changes can have a significant effect on reducing hypertension. It is not uncommon to find yourself with a long list of health issues such as high blood pressure, high cholesterol, etc. You can often treat these conditions by positively adjusting one's lifestyle. Here are 12 ways to lower blood pressure fast. 1. If you're overweight, then lose weight. The relationship between weight and blood pressure is well documented. Carrying excess weight increases the risk of developing high blood pressure. Conversely, losing weight can help lower blood pressure in people who are overweight or obese. This is because carrying excess weight puts strain on the heart and blood vessels, leading to high blood pressure. Losing weight can help reduce this strain, and as a result, blood pressure will drop. Obesity is also associated with type 2 diabetes and cardiovascular disease. People who are obese are at increased risk of developing type 2 diabetes, which is typically associated with poor blood sugar control. People who are obese also have a high risk of developing cardiovascular disease, which is a group of conditions that can cause heart attack, stroke, and heart failure. Obesity is a risk factor for stroke and heart attacks. In fact, overweight people are twice as likely to experience a heart attack than average weight. More specifically, being obese increases one's risk of suffering from high blood pressure, high cholesterol, and diabetes. 2. Exercise regularly. Hypertension is often called the silent killer because many people do not know they have it until too late. One way to lower your risk of developing hypertension is to exercise regularly. Regular exercise helps to keep the heart healthy and lowers your blood pressure. Exercise also allows you to cope better with stress, which can help to lower your blood pressure. The Centers for Disease Control and Prevention estimates that more than 2/3 of adults in the United States are not getting the recommended amount of physical activity. Exercise is also a natural diuretic, which means that it helps your body get rid of excess fluid. This can help you avoid some of the health problems associated with being overweight. Exercise can also enhance your brain's ability to improve memory and attention span. It can also help you feel more relaxed, which can lower your blood pressure. A few studies have shown that certain types of exercise are even more effective in lowering your blood pressure than others. The type of exercise you choose to do can also affect your blood pressure. 3. Reduce your salt intake. While medications can help control blood pressure, making lifestyle changes, such as reducing salt intake, can also help. In fact, reducing your salt intake by just 1,000 mg per day can lower blood pressure by an average of 5 points systolic and 3 points diastolic. You should also be aware that salt is in many other foods and beverages, including some spices, canned products, and even some types of cosmetics. If you want to reduce your blood pressure naturally, you should try to reduce your sodium intake. You can do this by simply eating fewer salty foods and drinks. The best way to do this is to completely cut out the salt from your diet. You can also try to cut back on the amount of salt you use in cooking and baking. 4. Avoid too much caffeine. Limiting caffeine intake can help lower blood pressure. Caffeine is a stimulant that can cause the heart to beat faster and raise blood pressure. Limiting caffeine intake to no more than 200 mg per day, about 2 cups of coffee, can help keep blood pressure under control. It may be helpful to avoid caffeine drinks such as tea and soda, which contain added caffeine. Caffeine raises your blood pressure by increasing the heart's need for oxygen. This is because caffeine causes the heart to contract more forcefully and quickly, leading to increased blood pressure. Caffeine can cause high blood pressure if you have pre-existing high blood pressure or your body doesn't handle it well. Caffeine can also lead to headaches and other symptoms of high blood pressure. 5. Drink lots of water. One way to lower blood pressure is to drink plenty of water each day. Water is essential for life, and one of the best ways to improve your health is to drink plenty of water each day. Water helps flush toxins from the body, regulates body temperature, and lubricates joints. It also plays a role in weight loss by helping to control hunger and calorie intake. But what about blood pressure? Can water help to lower blood pressure as well? The answer is yes. Drinking plenty of water is one of the simplest and most effective ways to lower blood pressure. Water helps to dilate arteries, which improves blood flow and reduces blood pressure. It also helps keep us hydrated, which prevents us from becoming dehydrated, a common cause of high blood pressure. And finally, water can help us maintain a healthy weight, another important factor in preventing high blood pressure. 6. Avoid alcohol. When it comes to blood pressure, alcohol is one drink that people should definitely avoid. Research shows that not only does alcohol significantly increase blood pressure in the short term, but chronic heavy drinking can also lead to hypertension. Alcohol is a vasodilator, meaning it causes the blood vessels to widen. This can be helpful when someone has low blood pressure because it increases blood flow and raises their blood pressure. However, for those with high blood pressure, Alcohol can cause an even more significant increase in blood pressure. This is because when alcohol is consumed, it causes the body to release more renin, a hormone that plays a role in regulating blood pressure. Additionally, alcohol can also lead to fluid retention, making the heart work harder and increasing blood pressure. Alcohol also harms the vasculature of the body. It is thought that alcohol causes a decrease in blood flow to the brain, which can result in decreased oxygen delivery to the brain and damage to arteries and veins in the brain. 7. Eat more foods high in magnesium. High blood pressure is a common problem leading to serious health complications such as heart disease and stroke. While there are many ways to lower blood pressure, eating more foods high in magnesium may be one of the simplest. Magnesium is a mineral that is essential for human health. It plays a role in regulating blood pressure by helping to relax the muscles in the walls of blood vessels. This, in turn, allows blood to flow more freely and reduces the risk of hypertension. Some studies have shown that people who consume more magnesium tend to have a lower blood pressure than those who consume less. In fact, increasing magnesium intake by just 100 mg per day has been shown to reduce systolic blood pressure by an average of 2.5 mm of mercury. Fortunately, it's easy to get more magnesium into your diet. You can get more magnesium from whole foods such as dark leafy greens and nuts, but you can also supplement with a chelated form of magnesium. 8. Avoid processed foods. You can help lower your blood pressure by making changes in your diet. One of the most important things you can do is avoid processed foods. Processed foods are not suitable for your heart health. They are high in unhealthy fats, salt, and sugar. They also tend to be low in fiber. All of these factors can contribute to high blood pressure. Instead, focus on eating fresh fruits and vegetables, whole grains, and lean protein sources. Another thing you can do to lower your blood pressure is eat more fruits and vegetables. These foods are low in sodium and high in nutrients that are good for your heart. In addition, try to limit the amount of saturated and trans fats you eat. Saturated fats increase bad cholesterol levels, raising your risk for heart disease. Trans fats raise bad cholesterol levels and lower good cholesterol levels, increasing your risk for heart disease. 9. Reduce stress. Your heart pumps blood throughout your body, and when stress raises your blood pressure, that puts a lot of extra work on your heart. High blood pressure can lead to serious health problems, such as heart disease and stroke. But there are things you can do to help lower your blood pressure and keep it under control. One important way is to reduce stress in your life. When you're stressed, it's natural to feel like you want to just curl up in a ball and hide away. But that's not going to do anything good for your blood pressure or overall health. It's essential to find ways to manage stress, so it doesn't get the best of you. Here are some tips. Exercise. This is a great way to blow off some steam and lower your blood pressure simultaneously. Meditate and rest. Meditation is a great way to relax and lower your blood pressure and stress levels. Get enough sleep. Getting just the right amount of sleep regularly is vital for your health. You're more likely to feel calm, content, and less stressed when you're well rested. 10. Quit smoking. Smoking is a known risk factor for high blood pressure. It can damage the lining of your arteries and make it harder for your heart to pump blood around your body. Smoking also can increase your cholesterol levels. If you smoke and have high blood pressure, quitting smoking can help to lower your blood pressure. Within just 24 hours of quitting, your blood pressure can start to drop. And within a few weeks, it can be down to a healthy level. In addition to helping lower your blood pressure, quitting smoking also has other health benefits, such as reducing your risk of cancer, heart disease, and stroke. There are many ways to quit smoking, and you don't have to do it alone. Ask your doctor for help, or call a quit line. There are also many self-help books and online programs that can support you in quitting smoking. 11. Eat dark chocolate. A recent study published in the British Medical Journal has shown that eating dark chocolate can lower blood pressure. The study, which researchers at the University of Cambridge conducted, found that people who ate dark chocolate every day had lower blood pressure than those who didn't eat any chocolate. The study only looked at people who consumed the chocolate in their diet, so it's unknown if it would work for everyone. The researchers found that eating dark chocolate every day lowered blood pressure by an average of 5.7 mm of mercury, Hg. Dark chocolate is high in antioxidants, which are believed to improve heart health. Dark chocolate contains phenylethylamine, PEA, a chemical that is also found in high quantities in the brain. P increases levels of endorphins, which is the body's natural painkiller. 12. Try the DASH diet. If you have high blood pressure, your doctor may recommend the DASH diet. The DASH diet is a healthy eating plan that can help you lower your blood pressure. It involves eating many fruits and vegetables while limiting added sugars, saturated fats, and salt. The DASH diet is also based on an eating plan called the Mediterranean diet, which has other health benefits. The DASH diet is based on the Dietary Approaches to Stop Hypertension, EASH, study. The DASH study found that people who followed the DASH diet lowered their blood pressure by up to 14 points. DASH was developed in the 1980s by the National Heart, Lung, and Blood Institute and is based on the Mediterranean diet. The DASH diet is low in sodium and saturated fat, two factors contributing to high blood pressure. In the United States, the National Institutes of Health and the National Heart, Lung, and Blood Institute have described the diet as a scientifically proven plan to prevent and treat high blood pressure. At the same time, it is recognized as a healthy eating pattern for preventing high blood pressure in Canada. In conclusion, there are many ways to lower your blood pressure fast. By following some of the tips above, you can start seeing a difference in your blood pressure in as little as a week. Just be sure to talk to your doctor if you make any significant changes to your diet or exercise routine.